burns. Okay, burn care. You're not going to see a whole ton of questions on the NCLEX about burns. I think that's because most new graduate RNs are not taking care of patients with burns. They're typically in a burn unit if the burns are bad enough, and it's kind of a specialized part of nursing. But there are a couple concepts that you need to understand, all right? So for immediate care of a burn, don't forget about ABCs, especially airway, when you're assessing burn patients because of the possible risk of inhalation of either flames or fumes. Okay, so I've told you before, don't put too much pressure or too much value on ABCs for patient prioritization, but this is an exception, okay? Airway, breathing, circulation is priority for burn care, all right? So don't forget about ABCs, especially the airway, when you're assessing burn patients due to possible inhalation of flames or fumes. So if you have a patient who's come in and they are missing their eyebrows and their eyelashes because there was a flash of some sort of flame. So say they were lighting their barbecue grill and they put on too much lighter fluid, or the gas in the grill accumulated and then ignited all at one time, or they were lighting their hot water heater, right? And a really fast flash explosion happened. So the flame goes from nothing to a huge poof and then out quickly. You may need to admit this patient. All right. Why? Well, if it's enough to burn their eyebrows and eyelashes off, it may not have scorched their skin, but the body's reaction to that flash is a gasp of air in. So they gasp in real fast. And when they do that gasp, they suck those flames and the fumes down into their lungs. And so it can burn their esophagus, it can burn inside their lungs, and they may not know it right away. All right. So over the next couple of hours or even shorter, their trachea may start to swell and close off because they've just inhaled those fumes. So this might be a patient that we're going to keep, and we're going to watch them and monitor their airway. Okay, that's why. Don't forget about airway when assessing these patients. They might look fine otherwise. You say, you just lost your eyebrows, you'll be fine. Well, you send that patient home and, an hour later they're back and their airway's closed off, and now you're trying to tube them with this closed off airway. You're better off to watch them and keep monitoring that airway and tube them before it is totally occluded. So for immediate care, pre-hospital wise, you're going to want to cover the burns with a clean, dry cloth or bandage. All right. You don't want to be removing any kind of encrusted items. You don't want to be pulling off clothes if they're burned on, or anything else that may be adhered to that patient in the burned area. So that's immediate care for burns. It's kind of in the field, pre-hospital. Then we want to assess what percentage of this patient has been burned, because this is going to affect some other calculations and other stuff that we're going to do for care-wise, once they're in the hospital. And for that, you use the rule of nines. You've probably heard of this before, but there's 11 zones on the body. Each one gets 9% of the total surface area, and then 1% is reserved for the groin. So the entire head and neck, front and back, is 9%. The upper chest counts as 9%. The abdomen counts for 9%. Each entire arm counts as 9%. The upper back is 9%. The lower back is 9%. The back of each leg is 9%. And the front of each leg is 9%. Okay, so then the last one is the groin, 1%. So that'll give you a good ballpark estimate of how much of a patient has been burned. Now, there's going to be 3 phases for the care of this patient once they're hospitalized. The first 24 to 48 hours, that's the shock phase. Okay, so we're watching the patient for shock. Right? And for this period of time, we're going to be focused on fluid resuscitation. This patient's going to be losing a lot of fluids right away. And for that fluid resuscitation portion, we use the Parkland formula. Now, let me just tell you right up front, they're not going to ask you to calculate a fluid volume to be resuscitated on the NCLEX using the Parkland formula. But I share it with you so that you understand part of this physiological change that's happening in the patient through their progression once they have sustained a major burn. So don't memorize this formula, but I just want to share it with you so that you understand kind of what's going on. You can see how it works and what's going on with your patient. And again, Parkland formula is for fluid resuscitation for the first 24 hours after a burn, and we use that to maintain cardiac output and to prevent shock. Right? So the Parkland formula says that we're going to administer 4 milliliters per kilogram of patient body weight per percent of that patient's body that has been burned. So let's do some math. So for example, you have a 75 kilogram patient who's been burned on 20% of their body. So we'll take 4 milliliters times 75 kilograms times 20% equals 6,000 milliliters. Okay, so 6 liters of fluid is going to get infused into this patient over the next 24 hours. So what do we give of that when? So you don't want to just give a 6-liter bolus to a patient, right? They're going to go into fluid overload. So how do we instill that fluid? So what happens is half of that total fluid, half of that 6 liters gets infused over the first 8 hours. All right. So for this patient, we're going to give half of the 6,000. So 3,000 milliliters or 3 liters of fluid over the first 8 hours. Then the second half of the fluid gets infused over the remaining 16 hours in that first 24-hour period. So half gets instilled in the first 8 hours. The second half of that fluid gets infused over the remaining 16 hours in that first 24 hours after the patient's burned. Then the patient goes into the burn phase, and this is the diuretic phase. It's also called the fluid mobilization phase, and it lasts for about 2 to 5 days. And for this patient, we're really going to want to monitor urinary output. All right, so we're going to monitor your urinary output hourly for this patient, and so to do so, we are going to need a Foley. Right, they got to be catheterized, or we're not going to be able to get hourly urinary outputs. So anticipate putting a Foley in them, and you're going to want to watch their potassium level and their hematocrit while you're in this phase, because if they're losing all that fluid that we just infused, right, that's 6 liters of fluid on the first day of the burn, well, it's going to be taking some potassium with it, okay? So it's a potassium wasting period, and we're going to want to monitor that. Now, the last phase is the recovery phase, and there's some major considerations that you want to take into account during this part. And they all start with P's. All right. The first is pain. Right. Burns are painful. All right. So you want to monitor their pain. The second is protein. In order for them to start rebuilding that tissue and skin, they're going to need extra protein in their diet. Right. The third thing that you want to watch for is to prevent infections. Right? So one of the primary roles of your skin is to create a barrier between the outside world and your inside world. All right. So if you've burned it off, now they're prone to infections. Okay. So we want to prevent infection. The fourth P stands for physical therapy. So if this patient has been burned over a large portion of their body, it's not fun to move. Okay. But in doing so, they are not going to necessarily regain full mobility in that limb if they're not doing physical therapy and keeping everything moving so that the skin stays flexible and isn't preventing essentially like a skin contracture. It's not a skeletal contracture like you'll have in some elderly patients, but this is essentially a skin contracture where the skin is too short to allow the joint full range of motion. So they're going to be doing physical therapy, which is going to be painful, which is why the first P stands for pain. And then the last P stands for psych. Okay. This is a psychologically devastating period for a patient who's been severely burned. They may appear different physically, They may wonder, what other people are going to think of them. Are they still attractive? Is anybody still going to like them? Especially if they have any sort of facial burns. There might be some disfigurement that's gone on. And this is the time that you need to support this patient. They're in pain. They're going to be in the hospital for a little bit. This is going to be an up and down time period for this patient. So really, don't forget that last P, the psych role, in supporting your patient with burns. So in wrap-up of burn care, you got your immediate care before you get to the hospital, so watch that airway. Don't forget that they may have inhaled fumes that burns in places that you can't see from the outside. Remember, don't be pulling stuff off of their burns, of any kind of encrusted items. You got the rule of nines for calculating the percentage of body surface area that's been burned. And then you got the 3 phases of burn care once the patient has been hospitalized. You got the shock phase, which is the first 24 to 48 hours. Then the burn phase kicks in days 2 to 5. And then you got the recovery time where you're watching for the 5 Ps: pain, protein, prevent infection, physical therapy, and psych. All right? So there you go. That's what you need to know for burns on the NCLEX.